So it finally happened. You struggled through some stuff in your life, you watched a bunch of TikTok videos, you had a talk with your doctor, sat down, and you came up with the diagnosis of ADHD. Now what? Why did it take so long? What do we do now? If this has been your journey, these are some of your questions, stick around with me. My name is Dr. Mirza. I'm a board certified psychiatrist in adult psychiatry, child adolescent psychiatry, and addiction medicine. If you're enjoying the content, please remember to like, comment, and subscribe. We always love the support. I made a similar-ish kind of video talking about, did I develop adult ADHD? I'll leave a little reminder tag somewhere over there, so check that video out as well. But let's jump into what we're going to talk about today. So why did it take so long for you to get an ADHD diagnosis? One of the reasons it took so long to get that diagnosis was because of the underrepresentation, the unawareness of ADHD, especially developing into adulthood. We see it a lot more. We have that stereotypical image of kids running around struggling in school, but at adults it shows up differently. ADHD is a neurodevelopmental disorder. It's there since the beginning. It just shows up a little bit differently. This goes into the whole concept of neurodivergence, that our brains work differently from everybody, and this is a big wide spectrum. So there isn't a quote unquote normal of how things are supposed to be. There's also the concern that there's a lot of stigma with the diagnosis itself, and then also stigma with the medications, the treatment. When we talk about the treatments for ADHD, the number one option, the gold standard, the one that's been shown to be the most effective over and over again, are stimulant medications. The stigma comes up when we talk about stimulants because they are controlled substances. And for a lot of people who are prescribers, doctors, pharmacists, etc., when people hear the word controlled substance, there's always that thought that this is a narcotic and this is something that's being abused and misused or being sold on the streets. So there's always this negative connotation that comes around, and it causes a lot of issues. For a lot of doctors, and I'm talking as a psychiatrist, when I was going through my training in adult psychiatry, there was always this something that was there that was like, adult ADHD isn't real, and people who are using Adderall when they're 30 years old are misusing it and abusing it. So nobody should have ADHD when they're an adult. When I then went on to do my training in child psychiatry, I realized how bogus this whole concept was. And it's not like you turn 18 and all of a sudden, boom, ADHD is gone. It's still there. There's also the issue too that pops up with the prescribing of it, right? Prescribing a controlled substance, especially something like a stimulant, Adderall, Ritalin, along those lines, is a pain in the ass from the doctor point of view. You can only fill a certain amount, 30 days, a month's worth at a time. You're not allowed to write refills on the prescriptions. You have to write a new prescription or send a new prescription every month. And at the same time, pharmacies, pharmacists, insurance companies, again, become very regimented, very structured in saying that, hey, if you're coming early or if you're coming on your fill date, something is wrong and you're misusing your medication. So the kind of vibe that we're getting is that there's always this kind of air of like, why are you on this medication? And I hear this from a lot of my patients, is that there's always this kind of judgment that comes when they go to pick up their prescriptions. One of the things also when they're trying to fill their prescriptions, and if they have to pick it up a day early for normal reasons, whatever, they're going on vacation, they're going out of town, they're always getting the nth degree of like, you can't do this. And even again, as a doctor, when I'm having to write the prescription and insurance companies are giving a lot of pushback, there's always the questions that come, a lot of the prior authorizations that occur. Are you doing drug tests on this patient? Are you checking this patient for abuse? Are you counseling the patient for abuse of medication and warning them of the addictive properties of this? It is this constant, like, something is wrong with these medications. You have to be concerned about them, and nobody should be using them. Another thing that occurs is the misdiagnosis of ADHD for something else. When I work with adults, I'll often have people who have had this history of having multiple diagnoses in their life: bipolar disorder, depression, anxiety, psychosis, substance abuse, and a lot of that comes from a refusal almost of somebody who's doing the evaluation to even consider ADHD as a diagnosis. ADHD, when it's left untreated, can present as all of those things. Particularly in young women, we see this showing up as this misdiagnosis of bipolar disorder. Untreated ADHD shows up as depression and anxiety when we have struggles with things like school or university or other kind of academic professional pursuits that are there. Sometimes these people have long histories of things like hospitalizations, suicide attempts, multiple medications and adverse effects, being treatment resistant because the medicine didn't work for them. I use this analogy with my patients all the time. When somebody has a broken car, a car that's not working for whatever reason, and you come and you fill up with gas, that may be a great fix for a car that doesn't have gas in the tank. But if the car has gas in the tank and the issue is more so that the tires need changing or the battery needs charging, you have to use the right intervention, the right treatment for the right problem. One of the initial reactions when I do an evaluation and we say, hey, this is ADHD, and they come back to me a month later, is almost shock and awe, and then there's a multitude of different reactions that occur. We sometimes see people lamenting about lost years of their life, or there's grief, there's anger, there's depression that occurs from looking back and seeing, why wasn't this there earlier in my life? I could have been doing this, I could have been doing that. I wouldn't have had these struggles if I had had this medication, this treatment earlier in my life. I could have avoided all these different things. And I've had grown adults crying in front of me because they're saddened and there's a lot of regret that occurs. And it breaks my heart when I see those things. The reason that I'm doing this kind of topic, I saw a video of somebody who responded to one of my TikTok videos, and she was in tears, and it got me, my black heart, it got me a little bit, that I was like, damn, this is the impact of what can happen when we treat somebody the right way and give them the proper treatment and tools for life. What happens now? What are some of the things that can occur now? How can we focus on looking ahead towards what we can do versus looking back and getting stuck in this cycle of guilt and anger? And we have to look at the fact that, we can't go back in time, we can't change those things, but there are different opportunities, there's different things that are there in our life that we can still change and have a positive impact on. Even for our day-to-day life, we can be more productive in terms of taking care of the house, taking care of family members, all these other things. I have had a patient who's older patient, retirement, and they got treatment for ADHD, and it allowed them to be a better spouse for their partner who is dealing with some health issues, being on top of treatments, being on top of taking care of that person, being more present, and that's what treatment allowed them to do. So there's always things that we can do. There's always things in front of us that we may not be expecting, and if we're there, we're present, we're able to be there and help out, can still make a positive impact on our life. And there's nothing to say that we can go back a little bit and pursue opportunities that we may not have had in the past, now that we have them and we have a better awareness of what's going on. All right, so I hope that gives a little bit of a guidance of some things that we can do when we get this late diagnosis, why it may have happened, and also that there's still time to do plenty of things, and opportunities that we thought may have been lost are still possibly there for the taking.